Hello, I'm Dr. Sankalp Singh from Yaami Fertility Indore. So this video is specifically for the couples where wife has low AMH or anti-Müllerian hormone levels. So the anti-Müllerian hormone is basically a blood test in which we check this hormone, AMH hormone. What this AMH tells us how many eggs are there in the ovaries. So AMH basically comes from the follicles, and that is the eggs, and it tells us indirectly about the presence of the number of eggs which are there in the ovary. Normally up till 30-32 years of age, this AMH is supposed to be more than 4 nanograms. But these days, due to a lot of issues, the AMH is reduced and it comes to less than 2 and many times less than 1. Now when it comes to less than 1 and maybe 0.5, 0.6, many times the fertility specialist advise that there is no point in getting a treatment done or getting an IVF done. It's better that you go ahead and adopt a child or go for alternative methods of treatment. Many times the doctors even say that you might need to go for donor eggs, and the patient doesn't want to do that. They want their own genetic child. They don't want to adopt a child. They say that, doctor, I want to try with my own eggs. I want my baby to have my own genes and my own genetics. Is there a possibility? So the answer is yes, there is a possibility, because AMH tells us about number of eggs. It does not tell us that these eggs, even though the number is low, it cannot give you a child, it cannot give you a pregnancy. It doesn't say that. What it definitely says that is when the numbers are less, the probability is less, but the probability is not zero. So there is a difference between these two statements. So once the egg numbers go down, unfortunately, there is no way, there is no treatment which can increase the egg numbers back to normal or increase it to any further extent. But there are treatments available to improve the quality of the eggs. That can be done by giving medications and by doing a procedure known as ovarian rejuvenation, which is done in a very specific time frame to improve the quality of the eggs. What that does is that increases the probability that the eggs which we are getting, even though the numbers are low, the chance that these eggs will give us embryos, that chance increases, and the probability that those embryos can give us a baby, also that probability increases. The next thing is, in such cases, what we need to do is do something known as embryo banking or embryo accumulation. What this terminology means is that we need to get the eggs in different months. We get, say, one set of eggs in January, make the embryos from those eggs and freeze those embryos. Then we try for taking another set of eggs, say in February or March, make the embryos and freeze them. So what that will do is, that will give us 2 or 3 different sets of embryos, and the total number of embryos would be more, and it might reach the number which is usually there with one IVF in a lady who has a normal AMH. So then your overall probability of pregnancy would be the same as what it would have been if you had a normal AMH. So embryo banking or embryo pooling is an excellent strategy for such ladies who have low AMH and they want to have their own genetic child. But you need to be persistent in your treatment to have that success, because you would need to have that process for a longer duration of time. So one such patient of ours, actually she had very low AMH of less than 0.1, and she had multiple IVF and it failed, and then she stopped her IVF treatment, saying that these things are not going to work for her. And then we did her ovarian rejuvenation. After that we did her egg pickups. So every month we used to give her injection, but most of the months there was no response from the ovary. So only 4 times we were able to collect her eggs, and that also just one egg. Finally we were able to make 3 embryos for her over 10 months of continuous treatment, and then we transferred those 3 embryos. Luckily it implanted, and she got one healthy child, a baby boy, who now is going to be around 1.5 years old. And she is a live example as to how being persistent in your treatment, how not losing faith, and the faith should not be lost by both the patient as well as the doctor, because we also were having faith in God that God is going to help us. She also had faith in God that God is going to help us, and she also had faith on us. So a combination of all these has led to a treatment success in this particular patient. And this is just one of the examples. We have multiple such patients who had success, and that's the reason that I tell the patients that don't give up hope. Just having a low AMH is not equivalent to not being able to have your own genetic child. You can have it, but go for the treatment. Don't take breaks from the treatment, and just go for it on a continuous basis till you get a success. All the best for your treatment.